Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
Hi, everybody. I'm Jessa, and I'm so happy you're here for this episode of Better Sex. I've dedicated my professional life to helping couples enjoy a fulfilling, intimate life. I believe that sex is important. Our connections to other people matter, and we're not living our life to the fullest if we aren't connecting emotionally and sexually with our partner. That's why I'm here, bringing ideas and information to help you live and love better. When I was in my sex therapy training, I was really struck by the whole topic and really the invisibility of sex and sexuality in the elderly. It is a common belief, I don't even know if people think about it, that somehow older people are not having sex. As if somehow this part of ourselves just dies, when we turn, 90, 80, 65, 50? I remember seeing it was on social media, some sort of post about, is there sex after 50? Okay. I'm almost 55 now, disclosure here. It's shocking to me that somebody would think, oh gosh, you turned 50 and somehow you wouldn't want to have sex anymore. Things change, our bodies change, we've got challenges, maybe the hormones aren't quite as driving as they were when we were younger, but there's just no reason to think that this core, essential part of our human nature just evaporates in a certain decade. And in our culture, at least, I can't really speak to other ones, there's complete invisibility about this topic. You don't see this in media, you don't see this in movies, nobody's talking about it. But sexuality matters for as long as we're sexual people. And I really want to bring this topic to my listening audience in case, first of all, who knows how old you are, but your parents, your grandparents, someday in the future when you're older, I want to normalize this idea that we are sexual creatures from birth until death. It's important and it matters, and it needs to somehow be honored and have some space made for it. Now, there are complications. One of the things we're going to talk about today in the show is the idea of being in assisted living or nursing care facility, and how can someone's sexuality, how can there be space for that, room for that? What happens when people start suffering from any sort of dementia? What does that mean for consent? The issues get complicated, but it's really important to talk about. I know that in my own therapy practice, so far, I think my oldest clients have been about 80. And when I say that to people, usually I say, isn't that great news? There are people at 80 years old who still care about their sex life, who are willing to come in and make it a priority and get the help that they need. I think that's great. So today's episode, Sex and Sexuality in the Elderly, I hope you enjoy. My guest today is Dr. Renee Flores. She's a board-certified physician in the field of geriatrics and internal medicine with 10 years of clinical experience. Recognizing that sexual health and emotional health are a salient part of comprehensive health care, she's expanded her role as an educator and sexuality and intimacy counselor. She works in collaboration with patients to address sexual desire, pain, performance, intimacy, and relationship challenges. Her work includes clinical interaction, individual and couple counseling, as well as education. She's actively involved in teaching medical students, residents, physicians, and people in the community, and she's devoted to lifelong learning and has an endless passion to continue education and training in the field of sexual health medicine. She's the ideal person to talk to me about this today. Welcome, Renee. So Renee, thank you so much for being with me today. I'm delighted that we're going to be talking about this topic.
Thank you for having me.
Yeah. So how would you sort of quantify or describe the value of sex and sexuality in the elderly? And maybe if you have statistics about how common or
okay.
Yeah.
I think sexual health is just so important across the lifespan. I know today we're kind of talking more about the elderly, but I think, we see a lot of the benefits when somebody is younger. There's less depression, there's more relationship value. This continues as someone gets older. It doesn't stop, just because someone is getting older. And there's a lot of studies, that are looking at sexual desire and, sexual health. And people do want to talk about sex and do want to continue a healthy sexual lifestyle. And so when we're looking at sexual health for this population, from 75 to 85, they're showing about, 38% have had sex with a partner at least once in the last 12 months. And so, and this is for men, and for women, it's about, same age group between 75 and 85, about 16% had sex with a partner within the previous 12 months. And so people are still engaging in sex and they want to talk about it. And I think it's really important from a quality of life standpoint that we continue to support the aging population and discuss sex with them.
Yeah. So I know in my own practice, I think my oldest clients have been about 80, which I think is just fabulous. I was thinking when you were talking about the statistics, it did make me think about if they don't have a partner, if they have been widowed, that must have a huge impact on that statistic, right? Like the number that might want to have had sex in that time, I bet would be significantly higher than those that actually had the opportunity to.
No, for sure. And, lifestyle changes do impact the elderly with disability and with becoming a widow. But, even sexual behaviors such as masturbation are seen in the elderly. And for men, 75 to 85, 27.9% have stated they've had masturbation within the last 12 months, and it's 16.4% for women. And so if they don't have a partner, they are still engaging in sexual practices.
Right. So those seem like, I didn't write your numbers down, but it seems pretty similar between the statistics for masturbation versus partnered sexual activity.
Yeah. So, even though their lifestyles may change or they may not have a partner, they're still engaging in sexual behaviors.
Yeah. So what kinds of changes in sexuality and sexual function do tend to happen as we hit, I guess 75 is the threshold for elder? Is that the really the line? But
I guess depending on the population, 65 and older can also be considered elderly. I guess 75 and older is the very elderly. People are living a lot longer, so I think
it's all kind of relative, 65 doesn't sound that old to me.
Yeah, for sure. But as you get older with females, the hormones definitely impact these changes. They continue to have orgasms, but maybe diminished. They may not have as many orgasms or have diminished quality or intensity of the orgasm. The thing about even both men and women, to consider them both, they both need kind of a little bit more time to rev up. Women in their, teens, 20s, 30s that are having sex, they start to think about does sex or have desire for sex or aroused, and they automatically will either have an erection or have, vaginal wetness. But that doesn't necessarily happen in the elderly. They need a little bit more time, so they'll have decreased clitoral engorgement, so they need a little bit more time for the clitoris to get stimulated. Of course, decreased vaginal lubrication with decrease of the hormones and menopause. The vagina, it needs extra time to become lubricated. The breasts have decreased breast swelling or breast engagement with sexual arousal. The vaginal area needs more time, again, like you said, for the wetness. And then, for men particularly, need a longer time to have physical stimulation or longer time to get an erectile response. They may be less rigid, but definitely do have that rigidity and that desire. And unfortunately, sometimes during erections or during sexual activity, the erections may soften, so they need more stimulation to keep the erection decreased intensity of the ejaculate and the volume itself. And they may take, again, a little bit longer to get to an orgasm.
Right, right.
So definitely things that, both men and women face as they get older. But again, these aren't, all or none. These are just delays in the stimulation of sexual response.
Yeah, and it's not insurmountable, right? Like I'm imagining, and I hear this sometimes in my practice, people think that these changes sort of signal the end, like if they have to work for it or if it doesn't seem to happen like it used to, it must be dead now, as opposed to understanding that they just need more stimulation and more time, potentially, to get to a response that they'd be happy with.
Yes, and I think the problem is that, there's all these magazines that kind of show statistics that you're supposed to be having sex this X many times per month, or your sex life is supposed to be X, Y, and Z. So society has just put too much stress, not only for the younger generation, but the older generation, because, these are outliers and these are things to sell magazines, and that's not real life.
Right, right. It's not real life for anybody, but it's certainly not real life once you're in your later years, right? These changes are normal. And actually in the introduction, I was sort of talking about, older sex is so invisible in our culture. You just don't see this anywhere in any media, So there's no way to have or it's very difficult to get a realistic perspective on what your sex life could look like in these later decades.
Right. And that's one of the reasons I really love the Golden Girls and Blanche.
Yes.
With her sexuality, but even her roommates kind of looked upon her as being abnormal for still wanting sex, but this is reality. People, as they get older, still want sex. It was kind of the other women that were abnormal, but when you're watching it, it's all comedy. But in reality, Blanche is probably the more common one that we see, at least in the elderly population.
Yeah, this is sort of an aside, but I think there was a series, I think they just had one season. I believe it was called Tell Me You Love Me. And that had the sweetest and most, accurate and inspiring portrayal of older sex, I thought. So if you haven't seen that, it might be worth seeking out too.
I'll have to check it out.
Yeah. So when you're working with patients, is sex something you're just bringing up with them proactively?
So yeah, I have to say, when I see, so I have a primarily geriatric practice, and a lot of them come in with a lot of comorbidities, diabetes, high blood pressure, arthritis. And so, it's not at the forefront of our conversations, but because I have such an interest in, sexual health, it is definitely something that I bring up. And, each person is different. Some people are very open to talk about it. Some people come back and talk about it. They're not maybe put off by that I brought it up in the first place. And, I think it just depends on the person. And if we don't ask, we don't know.
Right, right.
That's definitely something that I've, become more comfortable asking, and patients are becoming more comfortable talking to me about it as well.
Yeah. And it gives them so much permission, right? If you ask the questions, they may not want to talk about it or take it up right then, but at least they know they can. And yes. I just think that's, too rare in our society and even in medical practice.
No, for sure. I think, medical school isn't, they teach a lot about pathophysiology, but unfortunately sexual health is kind of left up to, therapists and psychiatry. And so, it's not something that unfortunately is taught as well in medical school as other subjects.
Yeah. Yeah. I'm always so appreciative to talk to, medical professionals like you that have gone and gotten the extra training, right? Who realize this is something that's missing and it's important, and, let's get the word out and the permission in the world,
For sure.
Yeah. So one of the things I particularly wanted to talk about today was the challenges that older people face, when they're in a nursing home or an assisted living facility, or, when they don't have the privacy of their own home, some of the issues that happen for them. And I don't even know what the question is. How can we support people to be sexual?
I think, no one wants to talk about sex in the nursing homes. The need for sex, doesn't disappear with age. And I think facilities just don't have the training to accept this as a normal part of life or a continuing part of life. I think a lot, it's coming on the forefront now. I think that kind of sparked with, what was his name? Henry Rands. When he was a lawmaker in Iowa, and he was initially charged with sexual abuse of his elderly wife who had Alzheimer's, and she was in a nursing home. And fortunately, that case, he was acquitted, but, there was a lot of tension between, that in that case, because, there was a, husband and wife, and the woman had Alzheimer's and he didn't, and whether or not there was consent to have, sex, and, the whole stigma between, okay, if you have dementia, can you actually give consent? And so, a lot of nursing homes aren't equipped to kind of deal with these situations. And something you mentioned, there's no privacy. So there's, a couple of components. And, I think with this case, I think there are starting, nursing homes are starting to address having policies for sexual health, and, addressing policies to say, okay, is there a private room for someone to be able to have consensual sex? And if there's a, in a different case, say, for instance, if someone does have dementia, being able to address whether or not they're able to consent. And so, these are long-standing policies, that should have been in place a long time ago, and unfortunately are just coming to the forefront now. And luckily, I'm hoping that, once, more nursing homes are facing or accepting that the geriatric population is sexually active, that there'll be more forthcoming with having education, not only for, the staff, but in general, just safe sex for the residents as well. So I think it needs to kind of be all 360, including policies for, the aides and nurses, and that, people know what to do when that happens, and they're not, shocked or put off by it.
Right. Now, I don't know this case. Is it pretty recent?
I believe it was a couple years ago, actually.
Okay. All right. So it was a man who was having sexual contact with his wife.
Mm-hmm.
Okay. And then the nursing home staff became alarmed, I suppose?
Well, I think it was, from what I understand, it was the family of him that were questioning whether or not it was considered consensual or if it was sexual abuse.
Yeah. And what a line! Like when can somebody no longer consent?
Right.
Wow.
And it's very difficult to say. I mean, there's so many struggles with even just regular consent. Can somebody make decisions? And so when it comes to sex, a lot of the same consent or the formalities need to come in and say, just because they have dementia doesn't mean that they can't consent for sex. And
or that they wouldn't still have sexual desire and, and drives, or you want pleasure.
Exactly.
Yeah.
So it's really hard to see what these boundaries for intimacy are, especially in dementia, and it becomes really tricky. So not only looking at nursing homes for, having sexual policies for patients or, residents are able to consent, but also, the ethical part of it where, what happens if they aren't able to consent.
Right. Hi, it's Jessa here, taking just a quick break. Thanks for listening so far. I wanted to let you know about the sex quiz that I've put together called How Healthy Is Your Sex Life? I've taken a close look at the typical ways that I see couples get into trouble with sex, including avoidance, neglect, negativity, distraction, and boredom. And the free quiz will score your individual results based on these factors. And then I provide my recommendations and ideas, including my top 10 sex tips, which will help you make instant improvement. If you'd like to take the quiz and see how healthy your sex life is, you can do it right now at sexhealthquiz.com. So if we're talking about residents that don't have dementia, I mean, we've already said, do they have privacy? Right? Because I don't know how much they're allowed to shut their doors with somebody.
Right.
And then you reference to, the safe sex practices, and is there support?
Right. All these functional changes that I talked about in both men and women, and the fact that this population really can't get pregnant. They think, that they don't have to use condoms or safe sex. And, in my own practice, I'm still diagnosing a lot of people with syphilis, which is transmitted. So there are a lot of sexual transmitted diseases still out there. And, just because they can't get pregnant, we see the sexually transmitted infections on a rise in this population.
Yeah. Yeah. And then I'm just wondering too about policies about masturbation. Did they leave you alone to masturbate?
Right.
Or are they frowning on every aspect of, sexuality that comes across their path?
I think, unfortunately, right now, without the proper training, they're frowning at everything, which is unfortunate.
Yeah. I'm having a memory, actually, of visiting my mother-in-law, and there was some older man who, he might have had dementia, too, and wanted to see the puppy that we'd brought in, and he started to touch himself, and they're sort of freaking out, and granted, we were in the room as visitors, but it wasn't exposed. But that made an impression even then, like how sad.
Right.
Yeah. I guess from what you're saying, there are no standards yet or policies that are adopted on any sort of national scale. Do you know anything about policies or advisory committees in the works to develop ratings about this or information?
I think it's individualized to the nursing facility, because each facility and even each state has different policies. And so right now it's at the discretion of the nursing home, so that I don't know of any as right now. There's no national policy to really address this. And because there's so many nursing homes in so many different states, there really does need to be a policy that kind of can, nationally cover to help both protect the residents that are having sex, with themselves or with couples.
Yeah. It would be nice if there were some guiding principles here for people. It sounds like important work to do.
No, for sure.
So it sounds like if somebody's in the situation where they're going to be placing a parent or a spouse or something like that, it's just going to be something you're going to want to ask about. Right?
No,
How do you handle this? What are your policies? What kind of training have your staff had?
No, and it's definitely something. And one of the things you say that, and I think as children, we don't like to think about our parents having sex or our grandparents having sex or, whatever the family member is that you're taking care of. But it's definitely something that needs to be brought up. You and I are both sexual health positive, but, and people that are kind of caregivers for somebody who's being placed in the nursing facilities, I don't know that that's at the, in the front of the mind of,
right.
Of decisions about how to choose a nursing facility. But yeah, something that definitely needs to be taken into consideration.
Yeah. So then I just hope we're sort of opening minds to this idea. Maybe everybody listening can hopefully identify with the idea that their sexuality doesn't just turn off at their next birthday, or 5 years from now. So maybe if they can picture that, oh yeah, I can imagine I would still be a sexual person, right. that helps them understand, like, maybe these other people like your parents are too, and that this matters.
I think all nursing homes want to ensure that the resident doesn't have harm, and hopefully facilities are going to start making these policies so everyone's protected.
Right. Because really having no policies just sort of opens you up to, risk or bad things happening, I suppose, as opposed to, wait, we have guidelines for this. We have ways to support our residents to behave safely and that we're safeguarding consent issues and things too.
And I'm not saying all nursing homes. I just, in general, I think that some nursing homes are behind in being able to address dimension, sexuality, and consent in the facilities. And there are, some facilities that are on the ball. So I just kind of want to throw that out there that I'm just generalizing. But I do know there are some nursing homes that are very pro-sexual behavior.
Yeah. Yeah. So it's worth asking and making that a consideration and maybe seeking to change the culture if your family member is placed someplace, to be an advocate.
Yes.
Yeah.
And, I was growing up, going through medical school, I was definitely a fan of Grey's Anatomy. And there was one episode where one of the main guys, Dr. Weber, had gone and his wife had dementia and he put her in a nursing home and he went to visit her and she was in bed with another man. And he was, livid and made a big scene. But this happens, quite often and more often than we like. And both the people in the scenario both had dementia, and she didn't remember him. And I've read in different stories where the family will know about their family member having sex, and they want their family. Say, for instance, it's a wife that's in the nursing home, and the husband will want the wife to be happy, and because, she doesn't remember him at all.
Right,
and
right.
There's that, that case scenario too, where, the family is willing to let their family members have sex at the nursing home. But again, there's no policies that ensure that privacy.
Right, right.
Those policies.
Boy, it just seems complicated,
Very complicated.
not straightforward. I mean, it's, I don't know, maybe this is a rabbit hole, but it sort of like has me back to the other end of life, like teenagers who also, are completely sexual beings. And how do you have policies and education so that people are safe and, without stifling people's sexuality, and yet to, craft things so people are safe and, I don't know, happy and successful.
For sure. And, I think there's a lot of research and investment in protecting the teenagers, and there's not enough on the opposite end of the spectrum where we need to kind of protect our elderly and make sure there are privacy and safety and concerns for the care and looking at it from that perspective as well.
Right, right. So where can people learn a little bit more about you if they want to follow up at the end of this?
Well, I don't really have a website. They're always more than welcome to check me out on the Government Medical School page and send me an email if they have questions, or if they're in Texas or in Houston, can come see me. I do have a sexual health clinic where they can come talk to me about their sexual issues.
Okay, great. And any other resources that you'd want to direct people to?
I think, there's a lot on the internet about, sexual health policies and nursing home care and dementia. And I think it's just important to have that education in looking at what the different comorbidities and how they can impact your sexual dysfunction. There's so many different ways that you can be impacted by disease, or even the medications that the doctor is prescribing.
Yeah.
That it's just important to use the internet itself as a resource and then say, take it to your doctor, or take it to your counselor or therapist and say, hey, what, I read this on the internet. Is this true? And this will help open up dialogue for the patients and whoever their care person is, just to help get them information and maybe some guidelines or some guidance to help them make decisions about their relationships.
Yeah, great. Well, thank you. Thank you so much for being here today. I really appreciate it.
Thank you so much.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get to know you and question and answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.